if you're having some family diseases that runs in your family, an earlier test is actually going to benefit you. Hello everyone, I'm Dr. Ashwathi Soman. So preventive care is the thing which you have to keep in your mind. See, once the disease have set in, for example, if diabetes have set in and you are having all the complications of diabetes, then a reversal is not possible. For example, if for a diabetic patient, if you are diabetic, then you have to have a eye checkup every year. If the eye checkup is normal, if it is not normal, then yes, you have to do it more frequently to see if there is any change that is happening. Not only that, so ideally, if you can find out if you're diabetic in the very early stage, the early care, you can give yourself a very early care, and then you can get a very good glycemic control. So diabetes is actually essentially, it's not just for diabetes, for any other disease. For example, say breast cancer, if you can find out in a very early stage, in stage 1 also, then the treatment is absolutely very wonderful and you will be actually cured of that disease. You need not have any complications pertaining to that disease in the later stages of your life. So yes, you have to find out if there is something bothering you in the early stage, but that doesn't mean you have to go frequently to a health lab check every fortnight. No, that is not what is warranted. It depends on your health status, your healthy diet habits, your lifestyle, the diseases what you are having, or your family history of diseases, your stress pattern, etc., your mental status, etc. So all these things actually, if you think you need a health checkup, you can just consult a doctor and ask him if you need a health checkup. So he might examine you, and for example, if you are having some heart trouble, only the doctor can find out if there is a heart trouble by checking your pulse or checking your heart rate. Yes, then you will have to go for ECG or echo test or whatever the doctor says. But apart from that, unless you are going in for a surgery to find out if you are having some other diseases, there is no need for a regular fortnight checkup of how healthy you are. If you are following all the healthy habits and you are having a healthy lifestyle, then only when you are having some trouble, there is a need for you to go to a lab and do a checkup. But occasionally, say once in 2 years or once in 3 years or 4 years, if you can go for a checkup, for a health checkup, yes, then it is fine. Then you can be double sure that you're okay. That's all. It's just for peace of mind that is actually warranted. But many tests, you will be asked to do many tests once you fall ill, or when you are not feeling healthy. Then on consulting a doctor, the doctor might, there might be some pointers in your disease pattern which the doctor might ask you to do. For example, if you are having some rashes on your body and you are having a fever, he might ask you for doing a dengue test. But that doesn't mean on a routine basis you have to go for a dengue test. No, that is not what is warranted. So depending on your conditions, so for example, some markers, he found out some tumors or something, and he is asking you for a tumor marker test, then you have to do for the tumor marker test. On a routine regular examination, you don't need to do a tumor examination test. That is not warranted. But if you're having some family diseases that runs in your family, an earlier test is actually going to benefit you. So yes, preventive care is better than preventive care, or finding it right before the advanced stage of a disease is always better for the management of that disease.